Hey guys, Dr. Andy here. Today I want to talk about the elbow. In this case, I want to talk about tennis elbow, okay? Tennis elbow is actually pain that we get along the outside of the elbow. Golfer's elbow, as opposed to, is actually on the inside, okay? So when someone comes in, they've got pain in the elbow, we are going to evaluate and check for tennis elbow or maybe golfer's elbow or something else. So we're going to run you through a couple of assessments. Usually it's pain with extension, so we're going to test and see if you push back. So Ms. Katie, do me a favor, I want you to push up into my hand right here, okay? If the patient pushes up into my hand right here, if you've got tennis elbow, you're going to feel pain along the forearm, the back of the forearm, and right here on the outside of the elbow. This is a chronic overuse problem, okay? That means what's going on is the tendon itself has gone through some damage over time because of repetitive use. It's called tennis elbow because it was the backhand of tennis. Over and over going through the backhand caused pain through the elbow with the repetitive wrist extension. But this can happen for anyone. If you're a desk worker sitting at your desk constantly with wrist extension, if you work construction, you're constantly going like this with the hammer, that's constant repetitive stress into the elbow with wrist extension, and this is where we develop tennis elbow, okay? So a lot of times you're going to feel the pain right out here at the edge of the elbow, and it's going to sometimes carry down into the forearm as well, okay? So one of the most common techniques that we do here in the office for that is Graston technique, okay? Graston technique is an instrument-assisted soft tissue mobilization technique, which is a really fancy way of saying that we use a tool or an instrument to help us do our job, all right? In this case, it's a soft tissue technique. Again, fancy way of saying we're working on the muscles and we're working on the tendons, all right? So to help the tool go nice and gracefully and smooth over the skin so it doesn't get caught up, it doesn't hurt the patient, we take a little bit of an emollient, it's like a beeswax, and we put it over the skin just like that so it glides nice and smooth. And don't worry, if you're the patient, we clean you off after everything like that too. So, and then we start taking the different tools and we start going through the area and we're checking to see if we can feel any adhesions or muscle spasms or trigger points down inside the muscle, right? So interestingly enough, we can actually take the tool and we'll rub it along the skin, and we can feel where it's nice and smooth, and we can feel where underneath it's kind of adhesions, right? So basically means it's kind of rough, it's tight down through there. It'll actually kind of imagine if you're rolling this and you feel kind of like it's bumpy underneath. That's actually what we'll feel. So we'll start going through the tissue, and I can feel immediately as we go through here. Even Miss Katie has a little bit of tension in her forearm right through here, probably from spent at our desk. At the desk at the welcoming our patients, and we're going through the whole forearm, and we're going to feel all of these little bumps, and where we feel the bumps, we know that we need to attack it a little bit more aggressively, all right? So it's going to be up here at the outside of the elbow, and then down through the top or the back of the elbow as well, all right? So once we kind of discover those spots with one of the bigger instruments for our Graston technique, we actually go in with one of our smaller tools and attempt to break that up, and actually what we're doing is we're stimulating a lot of extra healing through this area, bringing a lot of extra blood flow so that we get to start feeling a whole lot better and the area starts to heal. And so when we're using Graston technique or an instrument-assisted soft tissue mobilization or manipulation technique, we're going to attack it from multiple different areas. So we're going to kind of come from one side, spend a little while doing it that way, and then we're going to come from the other side, do it that way, and we're almost forming a little star. And we go in all directions. And what we're doing is we're stimulating growth, we're stimulating healing, stimulating a lot more blood flow to the area. Whenever you think of like a chronic, repetitive stress injury like tennis elbow, I want you to think it's not healing very well because there's not a lot of blood flow, okay? So anything that we can do to increase blood flow to this area, increase oxygen, it speeds up the healing process, and it's going to kill pain. So that's what we're going for. Man, again, we're trying to hit this elbow, and then we're going to hit down into the forearm all of the little spots that we felt with the bigger tool, kind of all of that bumps where it's like rough paper underneath, or good lord, I can't remember the name for it. Sandpaper. Here we go. Do you feel kind of how it feels different? Sometimes we'll hit some areas. Yeah, it feels kind of different. Yeah. Treatment takes about 5 minutes. We're being easy. We're just kind of demoing it for you today. It will appear nice and red after I'm done. Again, we're generating a lot of friction through there and a lot of extra blood flow. So it'll look all red. And then after we're done with this, we do some exercise. And the exercise just helps this tissue heal a lot faster, okay? That's Graston technique for tennis elbow. If you have any questions, send them my way. And always remember to live with passion, not pain.